When we think about environmental exposures, part of our job as environmental pediatricians is to help families contextualize risk and to really think about what may be top of their list. And so the things that we think of as top of the list include things like clean air and water, healthy homes and healthy schools. And certainly when a major concern of ours are the populations that are at higher risk, and that includes high poverty communities who often suffer from disproportionate burden of substandard housing. So a lot of attention needs to be given to the communities at highest risk and making sure that they have access to resources that exist to provide them with the interventions they need. So when we think about substandard housing, some of the things that we think about are poorly maintained homes, presence of peeling paint, lead hazards, environmental asthma triggers, which are common, which can include exposure to cigarette smoke, problems with mold and mildew, presence of allergens like pests and roaches, and some of the interventions that are used for those problems can also be problematic. For example, the ubiquitous use of pesticides indoors to manage the pest issue can all potentially provoke and exacerbate asthma in high-risk children. So when we think about individual risk, we think about a person's age, their gender, their race, ethnicity, their socioeconomic status, geography, and even individual factors like genetic factors which may predispose them to certain conditions. So high poverty communities are at disproportionate risk for a variety of factors, and that can include the housing mix, for example, and how those buildings are maintained and the types of materials that they may contain. If you take East Harlem as an example, for any neighborhood in Manhattan, it has one of the highest rates of complaints for housing concerns, including concerns around mold, for example, and pests and pesticide use. And that's partly because it has one of the highest concentrations of public housing for any neighborhood in New York City. And why we're concerned about that as clinicians is because I see a number of families who whose children suffer from asthma, who live in public housing where they may be disproportionately exposed to cigarette smoke, for example. So the triggers are widely pervasive. And until we address the environmental triggers, it's very challenging to manage their asthma. So as a pediatrician, I consider it part of my job to tell the stories of our patients, especially to the public health policymakers, so it can inform the interventions that are needed. And as a pediatrician who works with researchers, research is really a powerful way to shed light on issues like healthy buildings and healthy communities. And it's been amazing to see how this field has really grown just in the last 10 to 20 years. And what it's done is actually brought together people with distinctly different backgrounds to talk about how we can work together to promote the health of families and communities. So bringing together folks from the health community, from the architecture design community, from the urban planning community and transportation networks, to the policymakers. I think it's been amazing to see how no matter what hat you wear, we can all together make a difference with respect to making a public health impact. The most effective interventions are at the policy level. And while education and awareness is important, it's really at the policy level where we've seen a real effective change in reducing or preventing environmental exposures. And so whenever I get discouraged when it comes to policy change, I always remember the words of a very wise pediatrician who once told me let's make some noise, that together if we speak with one voice we can make a difference. And that's sort of what gets me through some of the challenging periods. It's been so helpful to see how every voice can have an impact.